Hey guys, this is Andy, and I'm going to take a few minutes and go through chapter 33 with you. That's obstetrics and neonatal care. Now, this is always a chapter that gives, or a section of the National Register that gives people a whole lot of headache. So I want to make sure that I spend a few minutes with you talking about this topic. So usually what I do is I'll stand up in front of the board and I'll draw a bunch of pictures and everything, and you guys get a good laugh out of all of my crazy female anatomy pictures. And then I realized that I turned the page and there was a great picture right there in the book. So what I'm going to do is I'm just going to be referencing the book. I hope it's not too boring, but I don't want to waste your time in watching me draw. Maybe you can come to a later lecture and experience that for yourself. So I'm going to start off on page 1187. And so I'm right here in this section is talking about hypertensive disorders. So this can happen. It's known as preeclampsia or pregnancy-induced hypertension. It usually will come on about the 20th week of pregnancy. Mostly, if it were to happen, it's going to happen with first-time pregnancies. Some of the signs and symptoms are listed right here. So that's severe hypertension, which is high blood pressure, we know, persistent headache, visual abnormalities, swelling in the hands and feet. I bet someone knows someone who has been pregnant and was complaining of their ankle swelling. Well, that's kind of a precursor for that and almost a warning sign. And also anxiety. So you can probably relate those things to some of the signs and symptoms just a normal person would have as far as hypertension goes. But this is all related to the pregnancy, okay? Now, it's known as preeclampsia until the condition worsens and it turns into a condition known as eclampsia, which is right here. Again, I'm on 1187 in your book. And the book says it's characterized by the onset of seizures that result from hypertension. So as the pregnancy is going along, somewhere around the 20th week or later, this could develop with the pregnancy-induced hypertension or preeclampsia. But if a seizure begins to happen, then that is called eclampsia, okay? And so it says in your book, and I've actually got it highlighted there, it says provide rapid transport for the pregnant patient having seizures and call for advanced life support or ALS intercept if that's available. Transport the patient on her left side so you can prevent supine hypotensive syndrome. So, when you think about seizures, when we think back to neurological emergencies, that period of time when the patient is having a seizure, they're not being properly oxygenated, so they're actually becoming apneic, and that's being transferred onto the developing fetus as well. So you can see how this would be, or why this would be such an emergent situation. And the normal drugs that the ALS crews would carry generally don't affect this situation. Remember, this is not a seizure disorder. This is a condition that's come on because of the pregnancy and this caused hypertension. Okay, so it is a true emergency. You need to know the difference between preeclampsia and eclampsia and what signifies the start of eclampsia. And of course, as I said, that is the onset of seizures. And remember that this red boldface word here, supine hypotensive syndrome, when it's talking about laying the patient on her side, that's just basically taking the weight of the fetus off of the inferior vena cava, which if you didn't do that, you would prevent blood from returning to the heart, okay? So that is why you would lay the patient on her side. So I'm gonna stop this video just for the ease of uploading it, and then I'm going to start another one talking about two more disorders.